All right, my name is Tobias Martin. I am going to be showing how to do the CPR process on an animal today. I'm using this raccoon here as my subject. In this case, we are going to be considering it an English Bulldog, which also means that we will be putting it in dorsal recumbency, as is normal for barrel-chested dogs. Um, so that is what we will be doing today. Um, so for CPR, weight of the animal somewhat determines how much pressure to apply. Um, when approaching the animal, it could benefit you to approach the animal from the rear, just in case it does happen to react or it is not unconscious or not breathing. And if it does react, wake up. Hopefully it won't go to bite you, or at least if it does, you'll be near its rear end and it will have a lesser chance to attack you or hurt you in any way. For most dogs or animals, we will be placing them in lateral recumbency, just so we have better access to the heart. But in this case, it's a lot easier for barrel-chested dogs, as they kind of have a crest that goes up near their heart here, and it's easier to access by just placing them in dorsal recumbency. So when we're doing CPR, we're checking for the ABCs or ABCDs, Ds having to do with drugs, potential application of that, if we're in a setting where we can administer that, and if it's applicable. So A has to do with the airway. Firstly, we're checking if there is anything lodged in the animal's airway. You're going to want to open up their mouth, look down their throat, check for that. In their nose as well, if you can. Equally checking for their tongue. Is their tongue stuck down their throat? Are they choking on it? It could benefit to pull out their tongue when you are doing the mouth to snout ventilation. And equally, it will ensure that when you close their mouth with the tongue out, they won't be choking on their tongue at any point, and the air can get through the airway better. B refers to breathing, so we are checking for chest movement, seeing if the animal is moving its chest at all, breathing. You can also try and feel if there's any air coming out of their mouth, out of their nose. And circulation has to do with pulse. In the video that we watched and was recommended, after checking for chest movement, equally we are trying to potentially wake up the animal by calling their name. So you would want to be pretty loud and yelling their name, trying to wake them up, like so. But depending on this animal's name, you'd be yelling like raccoon, raccoon. It would probably be louder than that, but in this case, I'm making it a bit quieter for the respect of my neighbors. But you're really trying to wake them up, trying to make them aware if they are possibly breathing or if they are conscious, just trying to determine that. But if you determine that they're not breathing, you can't wake them up, nothing's happening, then it is recommended, or at least in the video that I watched, it's unnecessary to check for the pulse, just for the fact as it may decrease survival rate because you're taking a longer time to check for the pulse. If it takes a while, you can't feel it and you think you're just not feeling it, this is a period of time where it could be used to do CPR on the animal. So this is potentially decreasing its survival rate and you just want to start CPR immediately. So small dogs, like Dobermans, boxers, small dogs and Dobermans and boxers, as well as cats, should have compressions directly over the heart. Again, they would be in lateral. Larger dog breeds are different and it would not be directly over the heart. And then in this case, barrel-chested dogs, like English Bulldogs, should be placed in dorsal recumbency due to their chest being wider than it is deep. And then, like we said before, they kind of have an arch over their heart, and then this is kind of where we're focusing. There's just easier access that way. So we're gonna want to compress the chest by 1/3, but no more than half of the width of the chest. This stuffed animal is very hollow inside. It's very soft. So with a real animal, it would definitely you would definitely need to be applying quite a bit of pressure. But in this instance, I will be applying much less pressure to demonstrate that we're not pushing down super far, or this could potentially harm the animal a lot. So we will only be pushing down, less than half of the width of the chest and about 1/3. Um, so what we're gonna do for like positioning, we're placing our left hand flat and open, and then we're gonna put our right hand over on top of our left hand and curled into, just like this. Um, your shoulders should be positioned directly over your hands. So you just want a good position like so. And then lock your elbows. You are not wanting to bend them because you're wanting a good position over the animal while you're doing this. And you're also going to want to bend at your waist to push, like so. You're not going to bend at the elbows when you're pushing because that's not going to give you really any beneficial movement, whereas your waist and your core is going to push a lot better. Um, so yeah, essentially that's the form we're looking for. All right. We are also looking for a specific amount of compressions per minute, which is very important. We are looking for 100 to 120 compressions per minute. Um, and another important thing we need to keep in mind is you don't want to lean on the animal. You're going to want the chest to fully re-expand to properly perform the resuscitation, to properly do the compressions. So if you are leaning on the animal and you're not allowing the chest to fully expand, it's not going to work properly. You're going to want the chest to fully re-expand when you're doing this. Equally, when we're doing this, it is very important to do compressions and the cycle of ventilation, mouth to snout, for 2 full minutes, uninterrupted. And when intubation is not possible, we will do mouth to snout ventilation. So we perform 2 breaths for every 30 compressions. And so essentially, like we said before, you can pull the tongue out if this is potentially blocking the airway. You're wanting to close the mouth tightly, and equally, you're going to breathe air into the nose on top twice. And especially keeping the head and neck as straight out as possible, especially with dogs like this that have a snout that's much closer to their body. It's not very long, brachycephalic breeds. It's very important that you're making sure their head and neck is straight, just so the air is properly getting through their airway and it's actually making a difference. But yeah, and then after these 2 minutes, you're going to want to check for your ABCs again. So check for the airway. Again, make sure it's not obstructed. Check to see if there's any breathing, if there's chest movement, and then equally, you're going to want to check for a pulse, which is very important. Attempt to do this under 5 seconds because, again, the longer you take, the longer you're taking to do compressions, and the survival rate for this animal can go down. So you're going to want to, if you don't see any of these signs of the airway being clear, if you don't see any breathing, any consciousness, or any pulse, you're going to want to immediately continue this cycle for 2 minutes uninterrupted again. And yeah, so just continue if signs aren't visible at all at that point. So I'm going to show how to do the compressions and ventilation for 2 full minutes, the cycle, and that will essentially cover pretty much everything, all the information you need. And equally, this being an English Bulldog, this being dorsal recumbency is a bit different. But yeah, I am going to go through the cycle of CPR, showing you what to do. We're going to attempt to do it for the 2 minutes, the cycle uninterrupted. And so yeah, I will be setting a timer for the 2 minutes. We'll go through that, and that will conclude our video essentially. So I'm going to be setting the timer now for 2 minutes. We're going to put our hand over like so. Again, the position we showed, elbows locked, shoulders directly over. At this point, we've checked our ABCs. The animal is not conscious, not breathing, and so we're gonna start putting our hand over the heart, and then we're gonna start with our compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 30. At this point, it has been 30 seconds, so we are going to breathe into its mouth, keeping its mouth shut, breathing into the nose. Equally looking for the chest to be moving when we're doing this, and then we're going back to compressions. So 1, 2, 3, 4, 5, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Mouth closed again, head straight. Back to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 30. Mouth closed again, head straight. Hand over again, one more set of compressions, and then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then one more set of ventilations. At this point, this has been 120 compressions. We've done it 4 times over. We have done ventilations 2, 4, 6, 8 times. So at this point, we're checking for our ABCs. Obviously, this cycle is a bit prolonged, and obviously, I would not be doing this explanation during it, but just trying to explain and narrate while going through. But again, we're looking for the airway, trying to make sure nothing else is obstructed as we did before. We're checking the chest for breathing. Is it moving up and down? Feeling for breath at all? And equally checking for the pulse. I believe it's the femoral artery that we can feel for the pulse. Although I believe for barrel-chested dogs, you could also feel over the heart, and it would likely be very easy to feel the pulse, as we were doing previous compressions over the heart, but we'll just check for the pulse as well. But hopefully at this point we see some breathing, or we see a sign of life, that the animal has been disturbed and woken up. Compressions have worked and CPR has worked, and if not, and we don't notice any of these signs, then hopefully we have another staff member or someone else that can do compressions, as this can cause fatigue very quickly. But if this is not the case, then you will just continue doing compression cycles for 2 minutes uninterrupted, do the ventilation every 30 compressions, and again, we will check for the ABCs after that, and hopefully the animal will be resuscitated if you are doing it correctly. But either way, this was the information on how to do CPR, the procedure, required compressions, and how to do a full 2-minute cycle with proper form and ventilations. So hopefully if you do get into this situation, you know how to do it properly, and it could save an animal's life. Thank you, and have a good night.